you so much. So I thought this was a really timely article that came out of the diabetes forecast. It's in a Healthy Living magazine for patients that have diabetes. You can find the article online. Your patients can get the magazine, or they can find all these articles online as well. And the article is titled "Getting the Most Out of Telemedicine." I think that during coronavirus, it's been a stressful time for all of us, patients and providers and educators, nutritionists, to figure out how best we can reach out to our patients and help them, and figure out how our patients can get help. And this article has been, I think, really great. It's very brief and succinct and gives some good tips on helping patients to get and reach out for help. So staying home, basically, it doesn't mean that you have to miss your doctor's appointments. In-person visits have really been the way doctors and patients communicate. But one of the greatest things I think that's come out of COVID is that it's really challenged our health system and made us grow in ways, it's sometimes painful ways, but it's made us grow as a health system and develop new avenues of taking care of our patients. You know, it's crazy that it's 2020 and we have not really utilized telehealth and telemedicine visits to reach out to patients who come from different states and may not be able to make their appointments, who may not have the money to buy gas to travel to us, to patients who may not have a car and may not be able to actually physically come, but are willing to see us through phone or video visits. And so out of coronavirus or COVID-19, that's changed. And now that we're trying to, spread the virus, a lot of people have urged patients to stay home and make these virtual appointments instead. I've been doing telemedicine now for 2 months. I've found that the learning curve for both patients and myself and our staff has been just like anything else. It's been a learning curve. But once I think you get the hang of it, you find that it is much simpler than you think. And we've also developed a lot of resources to help us get around, some of those barriers. And so you can use many different modalities for telemedicine: a smartphone, a tablet, or a computer. We found that there are a lot of apps that are really helpful, especially I think Epic is one of the most widespread electronic health systems. And there are apps that you can download for MyChart that we use, where a patient will put the app on their smartphone or their tablet, and they can access a video visit through a HIPAA approved platform through their app on their phone, which is what we've been using predominantly. But if they don't have MyChart, we tell them, don't stress over that. We also use modalities that are, Zoom or FaceTime. It's not as ideal because we definitely do want a HIPAA platform, but our goal, our bottom line, is to make sure that we're just taking care of our patients. And so any way that they want to communicate that's comfortable for them is what we try to do. In the past, 8 weeks, telemedicine appointments have pretty much replaced in-person office visits in many places. There was research done, quoted in this article, that had showed virtual visits increased by about 50% in March, which is just phenomenal. So patients, we try to tell them you're not limited to seeing just your endocrinologist or your family doctor during this time. There are many other providers that are also offering care via telemedicine, and many are covered through the patient's insurance, and we'll get to that in a minute. But people such as nutritionists, or I know our diabetic educators have had to reach out through telemedicine to help with insulin pump issues. There are, Medtronic is still available. There are still a lot of resources to be used besides the patient's family doctor or their endocrinologist. I would just like to bring up a point that was mentioned in the article I think is really important. During this time, it is a really common thing to experience low mood and stressful feelings, anxiety and depression, isolation during this time. Dr. Weinstock is a medical director at the Joslin Diabetes Center in New York. And she has also proposed, that we should be helping to screen patients, our patients with diabetes for depression during our telemedicine appointments. If you have the time and if you feel that, your patient is suffering from depression, to be able to help them get resources. And many times in the past 2 months, I think I've had to put diabetes on hold and actually help the patient get professional resources for mental health, which takes precedence to their diabetes. So I was really glad to see that in this article, Dr. Weinstock had addressed that. You also want to counsel your patient to look into their insurance. I think, the reason telemedicine wasn't really a popular used strategy was mainly because insurance wasn't covering it for us prior to COVID-19. And so now you want your patient to talk to their insurance companies just to make sure and figure out what, the nitty-gritty of their plan is and what their plan covers. Medicare has temporarily expanded their telemedicine coverage, including all the mental health counseling I just mentioned. And so that's been a great thing, and things have been expanded. So your patient can reach out to their insurance company to figure out exactly what's covered. And state to state, there's a lot of varying coverage plans as well. We did mention privacy concerns. If the tools that are used that are HIPAA compliant that I know of are definitely the MyChart through Epic. I'm not sure about the DoxyMe or the Doximity or all the different HIPAA compliant applications, but we first and foremost try to have all patients go through MyChart because we know that that is a HIPAA compliant platform. But again, if your patient can't do A, B, and C, we really try to be flexible and do whatever fits them best to try to help. In order to plan for the telemedicine appointment, it's just like anything else. We ask them to try to be thoroughly prepared. And that includes, we send them a sheet to help them set up their applications or their platforms or their, MyChart or whatever they're planning on using, their app on their phone, their computer, so that it's not a frustrating situation when they're trying to log on in that, 10 minutes before the appointment. And so we send them a guideline of what to expect and how to log on and how to troubleshoot, the things that they need to install and the websites to be able to install them. And if they need to register for new accounts, we give them the resources to do that, and our nurses will call them in advance to be able to help them do that. And then we always tell them, pick the device that they feel most comfortable using. So whether that's their smartphone, their tablet, their computer, make sure that, it's compatible with the provider's telemedicine program as well, but to make sure that they use whatever they're most comfortable with. And I found that a lot of people feel most comfortable with their smartphone and they know that the best. So that's really been utilized, I think, the most. And then we tell them to do a test run, to log on the morning of their appointment and do their test run to make sure they're connecting okay again, so that it's not a frustrating situation if they're, trying to log on in the 2 minutes before their appointment. And that's definitely irritating and an obstacle for appointments. And we tell them what to do in case the telemedicine or the video visit doesn't work. And in that case, what we typically do is convert to a telephone visit. And, if I haven't been able to connect for about a 15-minute period on video, then I will call the patient and we'll convert to a telephone visit, which also has been improved and covered by Medicare services as well, much better in the setting of coronavirus. I ask, or nurses, I should say, who are phenomenal, our nurses ask patients to make sure they collect their healthcare data that they're going to need in advance of their appointment. And so, we try to get them to upload their insulin pump or their continuous glucose monitor in advance of their appointment. So a few days to a week before their appointment, so that I have a chance to be able to interpret their CGM and their pump and make, changes to it before the same day of our visit. Or if they have a meter, to try to send us a snapshot, a picture of their meter, or send us a handwritten blood glucose trend log of what's going on with their blood sugars. Any kind of preparation that they can, do themselves and send to us is incredibly helpful, so that we can strategize during their appointment. And worst case scenario, if you can't do that, then they can always send their blood sugars following the meeting, and you can make adjustments afterward as well. We have a program too for patients that are on insulin pumps. There's a program called CareLink, where they are able to download their pump to CareLink, and then we simply log on and we can see their insulin pump settings and their trends as well, which has been really helpful in the setting of coronavirus. And just, outside of coronavirus too, having all these new resources and accessing them is great for all of us. Other pieces of information to gather before the appointment would include, weight. Weight has been really fluctuant in the setting of coronavirus. People are eating very different and trying to make do with what they have, which is a tendency to be mostly, boxed food, carbs. Carbs are cheap and easy. They're long shelf life. So it's important to make sure that their weight, what their weight has been, if it's fluctuant, what their blood pressure is running, if that's been fluctuant, if they have a cuff at home and they've been checking it. And also asking for any new or updated prescription information since the last time they've seen someone in the medical field, because remember, their medical reconciliation is probably, it's not been up to date for a few months. We haven't really, potentially they haven't seen a provider, so they haven't had a updated medical reconciliation. So that's important. And then if they've been seeing a dietitian, sharing any, food logs with us, the more information that they can bring to the table for us, the better. And then I always tell them to please, make a list of questions that they may have beforehand. So on the day of the appointment, to sit down and take a few minutes to themselves to figure out good questions that they would want to ask their provider, so that nothing is missed. And then, if something is missed, having them reach out to you on my chart or calling the office, absolutely. But just having them be prepared before the appointment. So like I said, I've been doing telemedicine now for 2 months, and I have found that it's been an incredible resource to us. And, I was seeing probably 20 patients in the office daily before coronavirus. And I'm seeing roughly, around 15, sometimes up to 18 patients on telemedicine after coronavirus had hit. So our numbers are close to pre-coronavirus numbers. I found that a lot of patients, regardless of age, are more than willing to log on and in one way or another. So through video or through phone. Also, families have been incredibly helpful. So if a patient is elderly and may not have resources to get on the internet, or if they don't have a computer, I've had many family members who have been able to call in and help their family log on for a visit, or even just a phone call. So I think it's been a tremendous new avenue to help patients. And I really am hopeful that, Medicare, Medicaid services continue to cover these things, because the amount of feedback I've gotten from patients who say, in the future, can we please have a telemedicine visit? I drive 4 hours to get there and it's a real hike for me. Is there any way we can schedule my appointment in 6 months or 3 months or whenever for a telemedicine visit? And it's a really great question, one that I don't know the answer to. But I think a lot of patients have found it to be wonderful, and a lot of providers too, because it's nice to be able to reach out to patients when they're in their own, comfort of their home, and they're not stretching themselves to be able to get to you, or feeling uncomfortable, driving 4 hours, or being ill and coming into the office. I've had several people who said, I have symptoms of coronavirus that I'm glad that I'm not coming in. What should I do? And so we've saved a lot of people from becoming ill too, by, I think, using this strategy. So that's my own kind of personal take on it. You guys can find the telemedicine article and online on the diabetes forecast. And I think, the admin from Echo is going to be sending that out if they haven't already. Does anyone have questions for me?
Thank you so much, Dr. Giordano. And I will include that in the recap email, the link to the website.
Great.
So any questions for Dr. Giordano?
I don't have a question, but I thank you so much, because honestly, that was so timely and so perfect for everything that everybody's doing right now. So thanks.
Thank you, Caitlin. Yeah, I feel like it's really the hot topic in medicine right now. And going forward, I really do believe that, even though things are opening up, I don't feel that a lot of patients, at least in my own opinion and in my own practice, a lot of patients don't feel comfortable also opening up and going out to their doctor, or going out anywhere. And so even though, politically in our country, things have changed, and, things are opening up, a lot of patients don't feel that way. So I think we need to adapt to figure out how we can reach those patients, because we all know that patients that have chronic underlying diseases, they're only going to get worse if they don't reach out for help and have continuous care. And so finding ways to reach out to them that are creative is going to be really important, because even though, we may be going back into clinic and sitting there physically, that doesn't mean that patients are going to be showing up the way that they used to, because of fears. So I think it really is an important thing to address.
Thank you. I was going to ask, as far as feedback goes, have you seen some of your patients preferring the telemedicine aspect, or do you think they sort of miss that in-person contact?
Yeah, I actually feel that most of my patients have asked. I've had so many people ask me to continue video and to continue phone calls. I think that every specialty has their own their own way of practicing and delivering care. And there are certain things where you really do need to see a patient, put hands on them, with, say, orthopedics. If someone comes in with a sore elbow, or a sore shoulder, or something fractured, that really requires a physical exam and a hands-on approach. But endocrine is a specialty that really lends well to doing telemedicine. I think that a lot of diabetes care is a back and forth of, okay, Dr. G, my sugars are this, and this, and how do we make good changes here? And, what should I do with my insulin? And that's an ongoing process that we do over the phone. Often, even pre-COVID, there were patients that would call in and say, hey, Dr. G, what do I do? So it was very similar to what I'm doing now. And so endocrine is a specialty that really just lends well to telemedicine. And I think, coming out of COVID, the things that I think that, all health systems and all physicians, providers, we're all going to kind of reevaluate, well, who can we see via telemedicine to make life easier for our patients? And, maybe not everybody, but maybe there are a lot of patients that could be served, by diabetic care and doing check-ins through telemedicine after maybe an initial appointment in the office. But, I just speak for endocrine. I think every specialty is incredibly different, and some of them really do require a hands-on approach. But endocrine, there are certain situations where we do really well by talking with our patients through the phone or through video. And I don't really feel like it's lacking. I feel like the care is equal, as seeing them in a clinic situation.
Right, absolutely. And like you said, due to that fear, even after COVID, it might even be utilized even more. So I'm glad to hear that it's just as productive, if not more, with telehealth and your experience. Thank you for sharing that, though. Any other questions, comments, concerns? How everyone's experience has been going as far as COVID and telemedicine? Feel free to use the chat as well. I don't want to keep bugging you, Dr. Giordano. I know you mentioned the HIPAA compliant apps and everything.
Mm-hmm.
I know some providers have shown some concern as far as being HIPAA compliant with telemedicine because everyone's in the same household and family members may be in the same room and everything. So how has that experience been for you?
Yeah, I think that the majority of my patients that have their family in the room purposely have them in there to help with the history, supplying the history. It's predominantly, my patient population been, maybe an elderly patient with diabetes who is a type 1 diabetic, and their family member has been helping them do injections and changing their doses. And so they really want that family member in the room. I haven't really experienced any patients I can think of in the past 2 months who have really struggled to get into like a quiet environment. I'm sure maybe that's occurred, but it's not something that I've seen. The volume quality has always been really good. It's not been, a lot of family members in the background. I think that most patients really do probably try to go to a quiet place even before the encounter begins to try to, watch out for that before the appointment or anticipate it.
Right, definitely. Thank you. So we got a question in the chat. So has anyone else been using telemedicine at this time? Yeah, excellent. Anyone else? Feel free to share your experience too. This is a safe, comfortable environment for everyone to chime in. So Caitlin says, great, just happy that everyone's been able to adapt. Thanks, Caitlin. Any other questions, comments? We still do have about 30 minutes of the session. And as always, if anyone thinks of questions after the fact, just feel free to email me as well, and I'll make sure to have them addressed. Thank you so much, Dr. Giordano. That was excellent.
Oh, it's a pleasure. I love Echo, and
yeah.
if anybody has any other questions, just let us know.
Yeah. Branya says in the chat that she loves telemedicine, and her patients have been loving it as well. So thanks for sharing. Yeah.
Wonderful.
It's been a great experience given the circumstances for everyone. It's been quite good. So I'm glad to hear that everyone's been having a good experience with telemedicine. And again, I'll include that link that you shared for us, Dr. Giordano, in the recap email. So everyone keep an eye out for that so you can just browse on your own time as well. Our next session for Endo will be on May 27th. And Giordano, the floor is yours for that session as well. So we'll touch base about that. And everyone just keep an eye out for the reminder for that session. And thank you all so much for joining. I hope everyone's been staying safe and staying sane. But thank you. See you all next time.
Take care.
Bye.